As future nurses, it is important to keep in mind that we will be caring for incredibly diverse populations. With 10% of the population being lesbian, gay, bisexual, transgender, or queer, it's important to not only free ourselves of personal biases, but engage coworkers to do the same. Part of the ANA's definition of nursing includes advocacy in the care of individuals, families, communities, and population. It's our job as future nurses to do just that, making sure compassionate, patient-centered care is in place regardless of gender or sexuality. In order to get a more intimate look into these diverse populations, we'd like to introduce 3 hypothetical patients and their unique struggles with healthcare.
To begin, it is important to recognize that sexual orientation and gender identity are different concepts. Everybody has both a sexual orientation and a gender identity. Your sexual orientation indicates sexual and emotional attraction to others. Some common sexual orientations are heterosexual, meaning a man is attracted to a woman or a woman is attracted to a man. Gay is a man being attracted to another man. Lesbian is a woman attracted to another woman. And bisexual is a man or a woman who is attracted to both men and women. Gender identity can be described as a person's internal sense of being a man, a woman, both a man and a woman, or neither. A transgender man is a person who was born as a female but identifies as a male. A transgender woman is a person who was born male but identifies as female. There are also people who don't identify strictly along the binary of male or female and identify themselves as genderqueer or gender fluid. Definitions of terms such as lesbian, gay, bisexual, and transgender are important concepts to learn, but it is more important to recognize that everyone is unique and deserves to be respected as an individual. Not every LGBT person will fit neatly into one of the LGBT categories. In the first scenario, we meet Jane. Jane is a 42-year-old woman who is active and maintains good health. Last month, she noticed a lump in her left breast accompanied by tenderness and swelling. She has just moved to Bethlehem, Pennsylvania with her 2 young children, aged 12 and 9, and her wife, Anne. When they were living in New York City, Jane and Anne saw the same doctor who they both trusted for the last 15 years, but neither of them know of any physicians near their new home in Pennsylvania. She remembers when she first came out as a lesbian in the early 90s and how she struggled to find a supportive community. Jane is concerned that she won't be able to find a doctor who is accepting of her lifestyle choices like her old doctor was, so she's been avoiding scheduling an appointment with someone new to get the lump checked. What should Jane do?
George is a 54-year-old male who has always lived within the farming community of Lancaster, PA. He lives there with his wife and their 2 grown children. Since elementary school, George has struggled with his sexual identification. For the past 10 years, he has been looking into changing his gender, but had felt defeated because of financial strain and fear of losing his family. Recently, George has turned to the internet to find a cheaper option to begin his transformation into a woman. George sees the internet as a perfect solution because it means he is able to avoid going to the doctor, while also hiding it from his family in the early stages. Would this be the best way for George to go through his gender transformation?
D'Angelo is a 28-year-old financial advisor who frequently enjoys the nightlife of Bethlehem. D'Angelo lives alone but has been in an on-off relationship with his partner over the past few years. Regardless of the multiple suggestions from his online community to get STD testing, he's been avoiding going to a doctor for even a routine checkup. D'Angelo has heard of upsetting scenarios where other gay men have been judged by healthcare workers because of their sexual orientation. He knows the risk of not getting tested but doesn't feel comfortable going to a doctor, and he doesn't know where he would get support if he got upsetting results.
This video, published in 2016 by The Oregonian, explores the scenarios of several transgender adults and their experiences navigating the world of healthcare.
My name is Leo Sell, and my pronouns are they, them, their.
My name is Sophia Stanford, pronouns she, her. I'm Gray, and my preferred pronouns are he, him.
Robin Kanawar-Haza, and I use feminine pronouns, so she, her, hers.
My name is Luke Jude, and I prefer he, him pronouns.
My name is Chloe Flora. My preferred pronouns are she or they.
99% of the time when I go to the doctor, I'm anxious and nervous.
Even though insurance and driver's license and everything says female, you really don't know what to expect.
Yeah, I don't think I know any trans person that went through the medical system and had a nice time with it. Not in this country. I haven't gone to the dentist in 4 or 5 years because it's just such an uncomfortable experience.
I know people who, if they sprain their ankle, will just wrap it up and put some ice on it rather than going to the ER and having an x-ray done, because it's just not worth the stress.
I've had a history of urinary tract infections. It was pretty commonplace for me, and I went to the urgent care, and the physician on staff that I was dealing with kept telling me over and over how atypical it was for a man to be having a series of urinary tract infections. I tried to interrupt him and say, I understand, I've been through a gender transition, so my anatomy is probably not what you expect it to be. And he kept stopping me. He wouldn't let me complete and assuring me that he did understand. And he said, I think I would like to take a look. So I pulled down my pants, and it wasn't at all what he expected. And he was immediately apologetic. He said, oh, you don't have, oh, I'm so sorry, I didn't realize. I said, I know, we tried to tell you.
I initially knew I identified and felt female around 5 years old when this was caught out by my family member who was the director of mental health for the state that I lived in, essentially required forced correction, like invasive hypnotherapy, corrective assignment and orientation to gender roles, other things to help masculinize and or reprogram the viewpoint of the world to the child. If I had to be this way, I'm going to walk in front of a car and I'm going to reset it and try over. That's what I thought when I was 6.
I had a bunch of different symptoms tied to sleep, tied to appetite, weight gain, mood, that had sort of increased in severity over a year. And one of the things that my doctor told me to do was check myself into a hospital next time I had my round of symptoms. So I checked into a hospital, and even just within the check-in process, I was misgendered. I finally spoke to the doctor, and he came in and was speaking to me as if I was a 13-year-old girl. And all of my symptoms were surrounding hormones. And when I started talking about hormones, this doctor in the hospital actually looked at me and said, oh, what do hormones do? I didn't think hormones did anything. And he actually checked me out of the hospital. He said, I think that you're just bleeding a lot right now. Fast forward 3 days later from this hospital visit, and I was diagnosed with invasive hormonal breast cancer that tested 99% positive for estrogen. And I think that if I had had the same list of symptoms, but was a cisgendered man, I would have been treated completely differently.
So in general, I've been blessed with a good primary care physician and an endocrinology doctor, but I was seeing a specialist for a different medical problem, and my records and everything all said female. I have everything changed. And the guy looked at it, he went through all of those steps, and then said, so do you dress full-time as a woman? And I was stunned. It's like, do you dress full-time as a man? Yes, I'm a woman. I am a woman of transgender experience. And of course, it's just like any other woman in your office.
The biggest horror story that I had was going to the pharmacy to pick up my first testosterone prescription. I was nerve-wracked already because it's like such an emotional thing to like finally get that golden ticket. It ends up being like $1. So it's just the syringes. There's no medicine. 4 people later, in about 20 minutes, they finally look it up in the computer and they're like, oh yeah, oops. Throughout this entire process, I have to say my legal name, which isn't the name that I go by, out loud to the entire store. And I'm basically outing myself to everyone around me. And that's not wanting to hide, that's just about trying to stay safe. Like, some people hear that and they might follow me to my car and bash my head in.
During one physical therapy appointment, I had one of the therapists misgendered me to an entire room of people, both other physical therapists and other clients. He never looked me in the eye again. He never talked about it. He never apologized. It was just this weight. And especially me as a trans woman, I get misgendered all the time. Like, it's something I deal with on a near daily basis. So to have that happen in a medical setting, something where I can opt out of, even though it might not be the healthiest thing, I will. I'd rather protect my own sense of mental health.
Barriers to care. Limited access. There's less likely to have health insurance due to unemployment, homelessness, or requiring services that are not available with health insurance. Many of these individuals have had negative experiences. They've had discrimination or prejudice in past healthcare experiences. Until 1973, homosexuality was listed as a disorder in the Diagnostic and Statistical Manual of Mental Disorders. There's also a lack of knowledge. Many providers do not have knowledge or experience to treat individuals with different needs. There are many health risks associated with being lesbian, gay, bisexual, or transgender, or queer. Youth are 2 to 3 times more likely to attempt suicide, and 20 to 40% of homeless youth are LGBT. Gay men, men who have sex with men, transgender individuals are all at higher risk of HIV and STDs. There's a higher likelihood of smoking, alcohol use, drug use, depression, anxiety, and other behavioral health issues. There's a higher rate of unhealthy weight control and unhealthy weight perceptions. Transgender individuals, in particular, have a high prevalence of victimization and suicide. Elderly LGBT barriers include isolation, diminished family support, a reduced availability of social services, and discrimination from peers in communal housing. This graph is from the National Health Interview Survey, which illustrates that people who have a different source of ongoing care by sexual orientation. It shows that those who are bisexual, gay, or lesbian had a lower prevalence of having someone to go for ongoing health care as compared to straight individuals. This National Health Interview Survey graph illustrates women who received a Pap test within the past 3 years by sexual orientation. Those who were gay or lesbian were less likely to receive one as opposed to those who were straight. And that one of the risk factors is also that they're less likely to get preventative services for cancer. There's lower rates of mammography and Pap smears. This illustration from the National Health Interview Survey shows that adult cigarette smoking is widely different by sexual orientation. Those who are gay or lesbian, bisexual, are more likely to smoke cigarettes than those who are straight. Some strategies for healthcare staff. Setting expectations and practical thinking. They may not have health insurance, or if they do, they may not understand their coverage. They may have been unable to express the true nature of their health concern due to a lack of trust, or simply because they are nervous about coming to the clinic. They may simply not know how to manage their own care. Some communication basics. Use terms that people use to describe themselves and their partners. Ask how they would like to be addressed. In a situation where patients' names or gender do not match their insurance or medical records, you can ask, could your chart be under a different name? Or what is the name on your insurance? You can then cross-check identification by looking at date of birth and address. Never ask the person what their real name is. This could imply that you do not acknowledge their preferred name as real. Avoid asking unnecessary questions. Before asking a patient something, ask yourself if the question is necessary for the patient's care, or if you're just curious. If you're just curious, it's not appropriate to ask. Maintain a non-judgmental attitude by checking your body language and facial expressions to make sure you're not sending unintended messages. Create an environment of accountability. Don't be afraid to politely correct your colleagues if they use the wrong names and pronouns. or if they make insensitive comments. Apologize if you make a mistake. Keep in mind the LGBTQ community consists of members from all different backgrounds and ethnicities. New strategies have been instituted to make sure that we are collecting data on LGBT community so that it will be easier to spot disparities or patterns. This will increase longevity and provide better care to the patients.
When addressing new patients or talking to coworkers about patients, avoid pronouns or gender terms like sir or ma'am.
How may I help you today? Your patient is here in the waiting room. They are here for their 3 o'clock appointment.
Politely and privately ask if you're unsure about a patient's preferred name or pronouns.
What name and pronouns would you like us to use? I would like to be respectful. How would you like to be addressed?
Ask respectfully about names that do not match in your records.
Could your chart be under another name? What is the name on your insurance?
Avoid assuming the gender of patients' partners.
Are you in a relationship?
Use the terms people use to describe themselves.
If someone calls himself gay, do not use the term homosexual. If a woman refers to her wife, then say your wife when referring to her. Do not say your friend.
Only ask for information that is required.
Ask yourself, what do I know? What do I need to know? How can I ask in a sensitive way?
Did you make a mistake? Apologize.
I apologize for using the wrong pronoun. I didn't mean to disrespect you.
The Bradbury Sullivan LGBT Community Center serves the Lehigh Valley by providing life-enriching LGBT arts and culture programs, leading-edge LGBT health programs, daily LGBT youth programs, critical supportive services, an annual regional pride festival, and an informative training institute. The Community Center provides educational sessions in healthcare, support groups for those who experience loss, and other weekly activities. Novus ACS is a Bethlehem-based healthcare clinic that focuses on fostering relationships with patients from a culturally respectful and culturally sensitive approach. Services focus on primary care, free HIV and STD testing, and providing patients access to prophylactic medications in a safe and comfortable environment. The clinic strives to keep patient care as low cost as possible in order to facilitate access to resources for patients from every socioeconomic status. Recognizing the need to aid LGBTQ adolescents, Project Silk was created as a joint collaboration between the Bradley Sullivan Center and Valley Youth House. The goal of the program is to provide resources, education, and care to LGBTQ adolescents between the ages of 14 and 21. Resources include leadership development, HIV interventions, and promoting adolescent self-advocacy in healthcare. The National LGBT Health Education Center website provides learning modules, educational videos, and webinars for healthcare workers. Some of their publications include 10 Things, Creating Inclusive Healthcare Environments for LGBT People, Collecting Sexual Orientation and Gender Identity Data in Electronic Health Records, Taking the Next Steps, Do Ask, Do Tell, Talking to Your Provider About Being LGBT, and the Fenway Guide to LGBT Health.
Some questions for thought. What would you do differently as a nurse taking care of an LGBTQ patient from the examples from the video? What personal and institutional changes are needed to reduce LGBTQ health disparities and increase access to care?